Ladies and gentlemen, Laurie Weston.
Okay, thank you, Rob, for that really embarrassing introduction. But today I want to talk about data, and I'm going to collect some data right off the bat. How many people have had COVID? Okay, roughly half the room, let's say. Is that all right? Okay, so we're going to use that data later for some analysis we're going to do on the fly. But I've had COVID, and COVID has become a household word over the past 2 years. It's affected everybody's lives everywhere around the world, young and old. Every part of our physical and mental activity, our social lives, our education, recreation, politics, and business, everything. So when I embarked on this investigation, it was really out of a sense of curiosity, just to see what the real information was, because I, probably like you, did not know whether I could trust what was coming at me from media, from government. And a lot of times, if there was data presented to put things in context, it was incomplete or poorly presented, or even to the point of manipulated in some way. So I being familiar with data and having some tools that are needed for this kind of thing, I thought I'm going to get my own data. So I did. So I'm going to talk today about death. So the data we're looking at today is all from Alberta government, and I know that you're probably interested in BC data, but really BC people are not that different from Alberta people. When you come right down to it, I know some people might disagree, but I think a lot of the trends and conclusions from this kind of analysis can be extrapolated to BC with some adjustments. But anyway, I'm going to talk about death today. So let's start by putting COVID deaths into context. First of all, by relating it to the flu. So I've heard at various times from various people that COVID-19 is just the flu. Get over it. Just live your lives. You get sick for a while, you get better. It's time. So I wanted to look at that from the data point of view. And the Alberta database has deaths of all causes for the past 20 years available online. So I downloaded all the data, and hopefully everybody can see these charts. So this one shows Alberta deaths from influenza from 2001 to 2020. And that's an absolute number, well, absolute, but scaled for population. So there's no population effects in these graphs that I'm showing. So you can see that from 2001 to 2020, pretty much the maximum flu deaths were around just under 140 deaths per year. Incidentally, this is the last time there was an international pandemic declared, which was H1N1 here in 2009. Doesn't look that serious relative to the rest of the years of the flu, but that was the last time a pandemic was declared, global pandemic. And every other global pandemic up until COVID was an influenza pandemic. COVID is the first SARS, CoV-2 phrase, pandemic declared. So let's now put the COVID deaths on this graph. So I've had to squish down that graph of flu deaths to fit the COVID bar on there. So where the maximum flu deaths per year were around 140, average is actually around 45 per year of all age groups. And the COVID bar in Alberta over 1 year was over 2,000 deaths. So, and by the way, these charts and data I'm showing you are almost all contained in some of the articles on big media. So this was from an article called COVID-19 is definitely not flu. So this graph helps put that in perspective. Now, some of you may already be saying, I'm skeptical of this data. You're saying COVID was probably way overcounted, or maybe you're saying COVID was undercounted. There are these suspicions that people are trying to push an agenda of some kind. Well, that may be possible, but in the data, we have ways of figuring out whether or not the accounts are reasonable and make sense. So let's go beyond the flu now to compare deaths of all causes in the past 20 years. Now these are, this is again Alberta data. So this is also all ages grouped together, but this is per 100,000. So now we're looking at death rates. So again, the population changes don't have an effect on this. This being Alberta data, interestingly, there's a faint overprint. So actually I've divided this by female and male. So females in the gold bars, males in the gray bars. So there's this being Alberta, there's a faint overprint here of the price of oil. Price of oil goes down, deaths go up, particularly for males. So there might, and when I say that there's some things that could be different in different provinces, well, BC might have, different factors, different overprint factors. But there will, and these local factors are going to make a difference. But overall, the demographics are probably the same. So we can see that the death rates for men and women are pretty constant over the past 20 years until you get to 2020. And then there's an increase, and it is the highest death rate ever in the past 20 years of this data. And everybody's nodding, going, oh yeah, that's COVID. That's COVID has made a difference. Well, this is a look back. So we know the cause of every single death on this chart. So I can just adjust this chart and highlight the parts of those bars that are COVID. So you can see the red part of those bars. I hope you can see the red part of those bars is attributed to COVID. And this is from the Alberta death. So every cause of death is attributed here. There's no prediction in this graph. And even putting that COVID highlight on there, we still see that those 2020 bars for men and women are the highest they've been in the last 20 years. So what's accounting for those additional deaths? Well, we're going to look at that in a lot more detail. First of all, we're going to take a little sideways look at the data itself. So do we trust the data? Well, we need some reliable data for this kind of analysis. And so I've got, like I said, data from the Alberta government database, and there's two different sources on the Alberta government website. One I call the health database, the other one I call the death database. And so I wasn't aware of this when I started downloading data, but the numbers are different on different databases, so they need to be compared. And when I say, do we trust the data? No, we never trust data. We always have to look at whether or not it's got integrity. We have to look at all of the different spelling mistakes or categorization errors or things like that. So there's no such thing as reliable data. We always have to look at it very carefully. So let's look at a little bit of the data sources. This is these are COVID death statistics that are reported, not everything, but deaths and everything else like hospitalizations, etc., vaccinations. So this is on the COVID-19 dashboard from the Alberta government, and we've got a similar one in BC. I had a look at it. And these numbers are updated daily, so you can get a daily running tally of all of these things. And at the time I pulled this or took this screen capture, 4,252 people in Alberta have died of COVID, and this is from the beginning, so cumulative. The death database, on the other hand, is not up to date. So these are causes of death. These are all causes of death. And this is a report on the Alberta Vital Statistics website. And all causes of death need to be reviewed by the medical examiner. So this can't be updated every day. And in fact, there's a lag of about 10 months. So the death data for 2020 did not become available until the end of 2021. So that's when I started doing the analysis with all of the numbers looking back. And when I mentioned about data being mixed up, well, here's an example of some of the data from that death database. This is just doing a search on poisonings. So I'm looking for poisonings from, let's say, carbon monoxide. So there, first of all, are 23 different kinds of poisonings. Some are accidental, some are intentional, some are undetermined intent. But I'm looking for carbon monoxide. So various categories here have carbon monoxide. However, some have gases and vapors that could be carbon monoxide. Some are gases and vapors spelled the Canadian way. Some are spelled the US way. Some have an extra S in gases. Some say carbon monoxide from unspecified sources or undetermined intent. So in order to find all of the different deaths associated with carbon monoxide, I have to look through this. And it takes a lot of manual work to look through this, to categorize things, to potentially correct some things. There are 4 or 5 different spellings of non-Hodgkin's lymphoma, some with dashes, some with capitals, some with whatever. So you cannot just take things at face value. All of these things have to be reviewed for integrity and completeness. So that is part of the background story. But let's now just get into some of the actual data. So here is the data from the Alberta Health Database. And this is the number of COVID deaths recorded in 2020. And now it's splitting out not only by gender, but by age group, because age group is important for this kind of analysis. And you can see that the 80 plus years, they're the ones that were hit the hardest by COVID deaths, male and female, female in blue, male in red. And as you get younger and younger, very little impact in terms of death. This is from the health database. And then, of course, I'm looking at all of the other causes of death. So I wanted to pull the COVID data from the death database as well. So here's what the COVID death totals look like from the death database. There's a difference. These scales are the same. So the death database across the age groups, across the board, had actually an average of 28% fewer deaths that got into the death database. So that what that means is that, what that means to me, and is that the medical examiner has looked at these. In the health database, they're just recorded every day from whatever information comes in. But in the death database, they're actually reviewed and audited in some way. So the number of deaths attributed to COVID dropped by 28% across the age groups. If you look at even the younger age groups, say the 30 to 39-year-old age group here, we've got a little sliver in the males. When we look at the data from the death database, that pretty much goes away. So this is something that kind of surprised me, but I thought, well, that's good. It's good that we're auditing these things and making sure that the data is reliable in some way, or more reliable than we're looking for. So now looking back at the deaths of all causes here for the past 20 years, we know that we've got a certain proportion are COVID, and this is from the death database. So this is now 28% less than what was reported on the database. And to be consistent, I wanted everything coming from the same database. Let's break this graph down by age group, because this is all ages together. Remember, men are the gray bars, women are the orange bars. And so this is age 20 to 29, and pay attention when we get to your age group. 20 to 29 and 30 to 39, 40 to 49. And I think we're seeing a pattern here. You can see in that 2020 bar. And also on every one of these, I've got the red indicator that shows COVID. So let me back up because I forgot to point that out. But age 20 to 29 is a red indicator showing how much of those deaths are attributed to COVID. Keep going, and 40 to 49, 50 to 59, 60 to 69, 70 to 79, and 80 plus. It's not until we get to 80 plus that the red bars actually account for pretty much the entire excess or increase in those bars when we get to 2020. So here's the all of those charts together, and the two things we notice here, just by glancing at all these charts together. Can anybody point out one thing that we noticed? Yeah. That's probably true. Yeah. Anything else? What's the elephant in the room here? Yes. It's pretty obvious. Men don't just live longer than women. Men are dying at higher rates at every single age group. In fact, almost double the rate.
It's not clearly indicative that women are killing men in Alberta.
Well, that's something you want to consider. So we should look into that. Remember, I have a cause of death of every data point here, and you'll see that there is some information that could fit your theory later on. Yeah. Yes. Okay, so that's one thing. The other thing is that every age group has more deaths than COVID accounts for. More so in the younger age groups for sure. So what are people dying of besides COVID-19? Here are some plots showing the top 6 causes of death. Accidents in yellow, suicide in green, purple is cancer, blue is unknown. And I'm going to talk about that a bit more later because you can see on these graphs how many unknown deaths there are. That's not just 2020 though. Some people say, oh yeah, well, those unknown deaths are uncounted COVID cases. Well, what about 2017, 2018, where we also have a lot of unknown deaths? So we're going to talk about that in a minute. And then there's brain disease, heart disease, and COVID in the right down at the bottom there. So you can see accidents in the age group 20 to 29 for males and females is the biggest cause of death. The unknown is, I was wondering about that. I was wondering why do we have so many unknown deaths? Like how come we can't figure out what people died of in this day and age? So I contacted the Alberta government, asked them where these unknown deaths come from and why are they more prevalent in recent years than past years? And the answer I got was that they are representing unnatural deaths that need additional investigation. So that's homicide, suicide, and accidents. So I asked specifically, would COVID cases be counted in those unknowns? And they said, you should not make that assumption. They didn't say no, they said you should not make that assumption. So they're unnatural deaths. So, so we've got categories for accidents, suicides, homicides are not in the big 6 in Alberta. Maybe that's different in BC, I don't know. But the unknowns need to be split out eventually, and they will be. That's why they're flat in the past, because they've gone back and viewed those and then assigned them to their appropriate categories. But there is a backlog of those. So, so this is the 20 to 29 age group. Here's 30 to 39, and already women are having fewer accidents than men, and men are still killing themselves in home improvement exercises or whatever it is. And then age 40 to 49, we start seeing cancer take over from women, and other causes of death increasing in men, but accidents still a top one. When we get to 50 to 59, that's when cancer is the top for both. Heart disease starts to creep up there for men. But one of the other things I noticed about this, and there's all kinds of different directions you go down when you start looking at data, is that you can see a decreasing trend in death rates from cancer, particularly cancer and heart disease over the years. And so in the past 20 years, we've actually gotten either really good at preventing these things or really good at treating them, or both. So we have a much higher survival rate now if you get heart disease or cancer than any time in the past 20 years. Accidents, however, are still up to the guys. So now we get into the older age groups, pretty much everything's dropped down except for the cancer and the heart disease, although brain disease becomes a bigger issue, especially for women in the later years. Okay, so that gives us a summary. Oh, and I have the COVID line, which of course is 0 all the way to 2019 and then pops up here. So we can see from any one of these graphs that COVID was, 4th or 5th or 6th or 10th because I didn't put all the ones in between the big five plus COVID. So there, COVID is down around 8th or 9th or 10th in terms of its rank in top causes of death. However, CGB published an article. As I was doing this analysis, I saw this article come out on CGB. It says COVID-19 killed more Albertans over the past 11 months than any cause of death in 2019, excluding only dementia and heart disease, according to the province's data. I looked at the labels here, and it's the same data I'm looking at. How can they come to such a different conclusion? They don't even put cancer above COVID. COVID is the third leading cause of death there in that chart. So what's going on here? Why are we so different? Well, first of all, they did not group any of those causes of death. They didn't go into the data and correct bad spellings and put different types of heart disease together. So they've got heart disease. That's it, is their category that is just barely above COVID. However, in this top 20 chart, there's already 3 other types of heart disease: heart attacks, atherosclerosis, and congenital congestive heart failure. You might want to group those together, at least in this top 20. But in fact, there are 26 heart disease categories in the death database, totaling 5,715 deaths. So that's way more than COVID. Same with cancer. They've got one type of cancer, lung and throat cancer, which didn't kill as many people as COVID. And the other thing is they're using the COVID numbers from the health database, not the death database. So they're already 20% or 50% higher, so 28% less than this year. You know what I mean? You can't do that in life. So they've got 4 other types of cancer here in this top one. And in fact, there are 62 cancer categories, totaling 6,869 deaths. So this is the kind of reporting you're getting. They're saying they're using data. They're showing you data. People are believing it. But yet this is misleading at best. And I would say it's actually irresponsible reporting. Same with accidents. 38 different types of accidents. They're only showing one. And suicide. One type of suicide. You know, there's like 6 or 7 different types of suicide. They also say that COVID deaths were 4 times higher than breast cancer deaths. Well, they're lumping men and women together, adding up COVID deaths from all men and women. Like, let's first of all look at only people with breasts, and then divide by the age groups. And so, if we look at only the female COVID deaths compared to breast cancer, you can see that yes, by the time on the above 80 age group, COVID is responsible for more deaths than breast cancer. But below 80, breast cancer is much more deadly. So this is the kind of thing, this is the kind of reporting we get from our national news sites. So the other thing about this group of charts is, of course, the additional deaths. So let's look at that. Let's look at excess deaths. And we hear a lot about that, especially recently. I've seen there's a couple of articles, and I'm going to show clips from a few of those, from the WHO, from the CDC, from various news sites that are talking about how there's huge numbers of uncounted COVID deaths because they're noticing that there are a lot of excess deaths. Well, let's look at that. Let's see, first of all, how you calculate excess deaths and what's causing them. Because remember, we're doing a look back here. So we're not looking ahead or looking at data where we don't know what the cause of death is. We have a cause for all of our data points. So first of all, I'm going to divide the age groups into smaller categories so that we're not averaging too many of the different ages, like the whole 10-year grouping. So I'm splitting these now into 5-year groups. So this is age 30 to 34, men in the gray bars, women in the pink bars, and COVID is shown again in the dark red. So you can see just a sliver of COVID up there. So excess deaths, we can obviously see that these bars in 2020 are much higher than the rest, mostly in men, but women too. And so let's look at what we would have predicted for 2020. So what I put on here are trends, and this line here at the top, that's a 10-year trend. So if we took from 2010 to 2019 and put a trend on it and extrapolated that to 2020, we would have expected that many deaths for men. If we use a 4-year trend, we would have expected that many deaths. And the same for women. We put a 10-year trend and a 4-year trend. They actually project to about the same thing. But either way, those two trends show us predictions of what we would have expected in 2020 as less than what actually happened. So this is a couple ways of determining excess deaths, and you'll see in news reports that they'll talk about Statistics Canada correcting for this and that, and they do very much more complex modeling than this, but there is just as much uncertainty, perhaps even more when they start bringing in all kinds of different things that they're trying to correct for. But these linear projections, they're going to give us an idea of what we would have expected. So the excess deaths are that part of the bar that is above what we would have expected for that year. So that's the excess death rate from the 4-year male trend, and that's the excess death rate from the 4-year female trend. So now in this next chart, what I'm going to do is just show the excess. I'm not going to show the rest of it because we're not interested in that right now, but I'm just going to show the excess in 2020 for all different age groups. So I showed you how we figured that out from 30 to 34. That's this. So now I'm showing just the excess bars here in men and women. So this is how many, and this is an absolute value now, since we only do 1 year, we want to correct for population change apparently. So this is the absolute number of excess deaths. It's about 143 or something. Excess deaths in men, and women were down here around 30. So this is what it looks like for all the age groups. And in every age group, except for women in 55 to 59 age group, there were more deaths than we expected. Let's now assign parts of those bars to COVID. So now this is how much of those bars can be explained by COVID. So there's still all kinds of additional deaths that happened that are not attributed to COVID. But it's still kind of hard to read that chart. So let's separate men and women. So now we've got the women on one chart on the left and men on the chart on the right. And again, we still got the part of the bar that is assigned to COVID deaths. Still a little bit difficult to see the trends. So now what I'm going to do is take those COVID deaths and cut them off the bars and put them beside. So now for every age group, I've got 2 bars. One is COVID, one is everything else. And now I think we can really see the trends of the excess deaths that come from COVID versus everything else. So on the chart on I actually have some counts here. So for women, there are 502 COVID deaths in 2020. 74% of those were above the age of 80. Total other excess deaths, 490, 79% under 64. Similar trend in men, only even more pronounced. Total COVID deaths are 610, 74% above 80, again, exactly the same as women. But other excess deaths, 1,223. That's twice as many COVID deaths. And those ones were 76% under the age of 64. So this age group of men between 20 and 64, that's the prime productive working years. This is when people are building their careers, they're building their families, they're building their their homes and their mortgages, paying things off. And that is where a number of these excess deaths occurred, and they were nothing to do with the disease, COVID. So how did those men die? Those additional 1,223 men, how did they die? Well, these are the categories that increased over 2019. And I'll read them out to you. They're pretty small here. First of all, this gigantic gray piece of the pie, that's unknown deaths. Remember those unknown deaths? were suicides, accidents, and homicides. So that's 56% of the pie is unnatural deaths requiring investigation. This big yellow wedge, that's accidental poisonings. This is alcoholic liver disease, diabetes, acute myocardial infarction, which is heart attacks, basically. Suicide by strangulation, cirrhosis of the liver. COVID is this red wedge here. COVID is 6% of the pie. The rest of them are all lifestyle or self-inflicted. And that's the causes of the excess death in the 20 to 64 year age bracket. Okay, so here's some recent headlines. Alberta sees a massive increase in deaths among youth during pandemic. So what they're saying here is they actually point out 731 excess drug poisoning deaths, but they don't say anything else about it. What they focus on is deaths which the study suggested are likely due to other factors such as limited access to urgent health care. So what they're doing is attributing excess deaths to either uncounted COVID. Here in another article about Alberta, this is a doctor from the U of T, Dr. Sharon Moriarty. She's written a lot of articles on excess deaths. She always attributes all of the excess deaths to uncounted COVID cases. So the pandemic's true death toll in Alberta is much higher, according to that study. Obviously, she hasn't looked at the data, at least in the way we did. The CDC and the WHO and even The Economist, globally, the model estimates that the total number of excess deaths is 2 to 4 times higher than the reported number of confirmed deaths due to COVID-19. They are just ignoring any other causes and assigning all excess deaths to uncounted COVID cases. I would like to know why. Why would they ignore things like that? So I would also say, if you look at a graph like this, are you likely to say that all of these additional deaths down here are due to uncounted COVID cases? I don't think so. I wouldn't do that. So let's say that those excess deaths are a result of COVID restrictions. That these are the group of people that are most affected by lockdowns. They're the ones that lost their businesses. They couldn't go to the gym. They couldn't have their social activities. Their kids couldn't go to school. All of their entire lives were disrupted and maybe even ruined. And so those are deaths that could have been because of lockdowns. The COVID deaths on this chart, these are deaths that are despite lockdowns. Like the lockdowns and restrictions are supposed to prevent death. So these ones, these red bars here, those are the ones that didn't get prevented. They died anyway. So the big question mark is, how many deaths did we prevent? If we consider these to be sacrificed to save people from dying from COVID, how many did we save? Was that sacrifice worth it? So that's really difficult to do because that's trying to figure out hypothetical COVID-19 deaths. And for that, we need a little bit of math. So first of all, let's look at this chart. This is the same chart that I was just showing you, only I grouped male and female together. Look at all the excess deaths for the males and females, and then the COVID deaths for males and females. And the reason I'm doing that is because I need to know the number of cases. I need to know the number of COVID cases or infections in order to extrapolate it. And those are reported in 10-year age graphs, age intervals, and with men and women together. So I restated this graph that I've shown before. And now what I need to do is I need to do a little bit of math. So I need to find out how many deaths per infection there are in each age group. And that's reported. So that's reported on the the Alberta Health Database and probably in BC as well. So this reported death rate, remember, the deaths reported on the health database are overstated, so we need to reduce those by 28%. And the cases, the number of cases, I haven't talked about that before, but the number of cases reported are generally underreported because, you know, I didn't go and report my COVID infection to the doctor. Most people probably didn't, especially younger people. So there are estimates that it was up to 5 times as many people were actually infected than were reported. But in any case, I'm going to be conservative here. So what I'm doing is I'm saying reported deaths were too high, so I've reduced those by 28%. Reported cases were too low, so I multiplied those by 2, which is still fairly conservative. And what I also need to know is how many cases there would have been had there been no restrictions. So that's a really difficult number to determine. So that's where the data comes in that I collected at the beginning of this talk. So about half the people in the room said they'd had COVID. Okay, so we know that vaccines did not prevent spread of infection, really. Maybe there was some period of time when they did, but overall they didn't really protect us. I was vaccinated, I got COVID anyway. So that the number of people who have it now or who have had it over the past 2.5 years, pretty much vaccinated or not, kind of gives us an idea of how many people that would have COVID infections would have spread into what proportion of the population. So I'm going to put 50% here, and that's pretty much exactly what we surveyed at the beginning of the talk. So if I put all those numbers into this calculation, when I do it for every single age group, I get an estimate of how many COVID cases we might have prevented with those restrictions. So again, I've had to adjust the scale. So this is our original graph. That's the excess deaths. And remember, if there were no restrictions, these excess deaths might have gone away. But that hashed red part, that's the additional COVID deaths that potentially we prevented. So that's a good thing if we prevented deaths. But let's look at the comparison. So the total number of deaths we would have prevented, given these assumptions and calculations, 3,100, sorry, the total number of COVID deaths we would have had 3,190. That's 2,078 more than what we did have. So we could say we prevented 2,078 COVID deaths in Alberta. The excess deaths that we could say were due to the restrictions is 1,569. So we sacrificed 1,569 to save 2,078. So, okay, a net benefit. But most of these COVID deaths are over the age of 70. Under 70, we sacrifice people for not much gain. So could there have been a better way of protecting those people without killing those people? Now, shifting gears a little bit, I want to go back to some news report, and this is from BC. I don't know if you've heard this one, but this is Ross Whiteman. He lives in Lake Country in the Okanagan, and he was diagnosed with Guillain-Barré syndrome after his first and only dose of the AstraZeneca vaccine. We're not going to talk about vaccines or vaccine effectiveness or anything in this talk, but I just want to point out how the media reported this. So, he was given a payout. So the health authorities agreed that this was due to his vaccination that he got this disease. So that's been reported. But then they showed a bunch of data along with the article. So they talked about 11.7 million doses of the COVID vaccine have been administered in BC. They talked about there have been more than 41,000 deaths associated with COVID-19 in Canada, and that the risk of this particular syndrome following a COVID-19 vaccination is 1 in 700,000. So they've given us data. Does this make sense? Is this relevant data? What they're doing is they're putting this disease in context with other data to give us some information to, I think, put us at ease that chance of getting that particular disease after vaccination is very small, especially compared to other things. 41,000 deaths associated with COVID-19. But what's wrong with this reporting now that you've seen the data analysis in this talk and we've seen some of the other CTV reporting, for example? What's wrong with this? Why would those statistics not tell us something useful?
It's only one of many vaccines.
Yeah, some of those things. The other thing is, pardon me?
The BC members versus Canada.
Exactly. BC versus Canada. So they've switched from BC to 41,000 deaths in all of Canada. So they made it sound really bad. Not only that, in almost all articles that talk about individual people, they say woman 52 hit by a car and killed, man fall off motorcycle 25 died. The man's age is not mentioned in this article. It is conspicuously absent. They didn't mention his age, but look at him. He's probably early 30s. He's fit. He's got young kids. In the article, they talk about how sad he is that he hasn't been able to go and do athletic activities. He used to be involved in all the team sports. This is a fit 30-year-old. So why would we look at 41,000 deaths in all of Canada of all ages, both genders? Why would we not compare the number of deaths in BC for a 30-year-old fit man to this? So anyway, this is just the kind of thing that is done to mislead people, deliberately mislead people. Okay, so given that, what have we learned so far? Well, first of all, COVID-19 is far more deadly than the flu, so we can just dismiss that particular objection and say, yes, we have to deal with this as a deadly disease. But we have to also look at different age groups. We have to look at who's affected and to what extent. And we also have to pay attention to those additional deaths that aren't due to COVID and may, in fact, be due to our response to COVID rather than the disease itself. We also have to be very wary of what we're seeing in the news because either people don't know how to present statistics or they're deliberately misleading statistics. And also, what are we dying from? How do we put this in context with other types of death? And in fact, we should know about these things so that we can pay attention in our own lives, especially you guys. Try to be a little more careful. And then there's the excess deaths. Now we've learned how they are distributed across age groups, across genders. And we've learned a little bit about what the excess deaths other than COVID are: the accidents, suicides, the unknowns, which are the unnatural deaths. And finally, we've looked at potentially how many deaths we could have saved with these restrictions, because that was the point of them. The point was that we wanted to save people's lives. And yes, it looks like we probably did save quite a number of lives, but was there a better way of saving those lives without restricting other lives? And these are the things that we didn't know in advance. We didn't know these things. At the beginning of the pandemic, we did not know these things, and obviously something had to be done. So these restrictions were put in place, but I had to wait until the end of 2021 for the data that showed all of these trends, whereas likely the government was seeing it a lot sooner. This is a public database, so and people were paying attention to these things. So the the trends would have been noticed or should have been noticed well before that, and perhaps adjusted. So in summary, COVID-19 is a serious disease. And of course, there are more aspects to the pandemic than just death. There's all kinds of other side effects of the disease and long COVID and things like that, and hospitalization and whatever. So I'm not going to, I didn't go and look at all of those other aspects. There's obviously complex interactions between the disease and our response to the disease. So when one aspect of society is manipulated, and we see this in anything that government does, whether it's financial or policy or whatever, they manipulate one aspect of society and some consequences, both known and unknown, pop up in other aspects. And so we have to pay attention to those. And in order to pay attention, a thorough look at the data is required to really understand the impact and appropriate response to the spread of the disease and the measures imposed to limit it. And that response has to evolve as data comes in. I've heard people say, oh, that politician is changing their mind. Well, that I would rather they do that than stick to something that doesn't make sense, because the data comes in, you have to be flexible, you have to be adaptable, and you have to respond appropriately. And we don't know that up front, we're always learning. So transparency and flexibility are one of the most important things. So that's it for the data today. So now I will take any questions. Thank you for your attention.